Welcome to Costa Rica. My name is Johnny from Johnny Knows Costa Rica. Today we're going to talk about artificial intelligence. And you might say, Johnny, what are you doing talking about artificial intelligence here in Costa Rica? Well, some of you don't know, in my life in the US, I worked a lot in healthcare, but in IT. So I know quite a bit about it and honestly how to execute it and how to govern it. But here in Costa Rica, it's just like a lot of places in the world, there's a little bit of skepticism on how artificial intelligence should work or how it should be done. So you know what? I took the time and liberty in these past 2 years to start developing a program and initiative to present to the healthcare system here in Costa Rica, but also the legislative branch to make it law. Because you know what? You can't have a great tool without some governance. You need to take that tool and have governance. I believe strongly that doctors are so important, especially in healthcare, to help make those decisions. But also, they are such, you know what? They're such an important commodity to help us that the first line healthcare, and my belief on this program is that, you know what, we need their guidance, we need their acceptance, and we also need that last portion of the diagnostics that they need to be involved to make that decision, along with artificial intelligence. The reason why this is important is that as a nation here, and some of you is right, retirees are coming, the population is growing. Now, I want you to think this very thoroughly. If you have 5 million people and you have 65,000 employees in the public healthcare system, and then 40,000 in another section, and a total of 20,000 doctors enrolled into a system, we have to, you know what, we just have to look at things and say, you know what, we need some help. And part of that help is an avenue to provide the first line health care, to help the physicians make decisions. They have the ultimate decision, but help them make the decision and be that much quicker for you and I. Why is that important? Because in the future, I want to quote something that I had an interview with Dr. Munive, which is the Ministry of Health, Minister, I can't even speak today, the Minister of Health, which she's also the second vice president. She has this great initiative that a political a political schedule of how healthcare should be for this 2032. And in that political area that she talked about how seniors are going to grow in this country. Right now, there's 500,000. She predicts that in that time period, we're going to double. What does that mean for healthcare? That means that the 60% of occupancy right now in the healthcare system inside our beds in the hospitals, which is seniors that are occupying it, and has been statistically found, because I've looked it up and I've compared with the hospitals, of how much occupancy is seniors, is 60% now. And if we're going to double that population, what's going to happen to the healthcare system at that point? You know what? We need to help, but we don't need to complain about something. We need to provide a solution. And the solution that I'm proposing with the healthcare system is a virtual doctor with intelligence, but artificial intelligence that works in conjunction with physicians. Now, why is this important? Because when you take the physician one-to-one, is they can take care of between 25 and 35 people a day. With artificial intelligence, that number skyrockets. Now, that number skyrockets if it's first line healthcare. That's the proposal, first line healthcare, which is very important. Now, the doctors here, they would have the final decision on the diagnostics. That's the proposal. But this is a start of, you know what, a healthcare system that is shown the caja. If for those of you who don't know, in the early 1950s and to now, the life expectancy in Costa Rica in the early 50s was between 50 and 65. Now, the life expectancy now in Costa Rica, with the great work that they've done, it is now 88. What does that mean? Does that mean the tough system that we look at today to get appointments and things is failing? No, it's not. They're doing their job, but you know what? It's called growing pains in healthcare. They need help. One of the things in this proposal will do is give that much needed help that they need on a constant basis. Now, I'm going to leave you with this. I want you to think of healthcare in Costa Rica as first world, and I'm going to tell you why, and not as third world, because any system that increases the life expectancy of its citizens, it's due the respect that it should be. There's a lot of areas that you may or may not know, but get involved, ask questions. Why? Because there's things that in this system will help you have a better quality of life, but you have to be involved. So something I'm going to leave you with. You need to go get checked, go to the device, which is the urgent care, and start that at least once a year. Most of you talk about, hey, you know what, I pay for health care, but I really don't get use. You have to do the first step and go and take it. Well, you know what, I hope this information about artificial intelligence was good for you. I'm going to elaborate as we go on, and I'm going to tell you as we progress how we're going to progress. Pura vida, and always be safe.